Back to a story I've told a lot of people over the years. I remember when I was 6 or 7 years old and riding a bike, learning to ride a bike, and I came down Franklin Avenue and turned onto Carson Avenue, and I hit a parked car. Oh, go ahead and laugh at the poor 7-year-old for running into the parked car. Ran into a parked car, hyperextended my knee. My dad took me to the hospital. We met our pediatrician, Dr. George Clock. I remember his words distinctly. He put me up on the table like these kids. Put me up on the table. He moved my knee one way and said, "Did that hurt?" And he moved it the other way and said, "Did that hurt?" And it all hurt. And I remember distinctly. He said to my father's name was Paul. He said, "Do you have health insurance, Paul?" And my father said, "Yeah." Well, first he said, "I don't." These are the words that are like seared in my brain. He said, "I don't think anything's broken." That wasn't very reassuring to a 6 or 7-year-old. "I don't think anything's broken. Do you have health insurance, Paul?" My father said, "Yeah, we've got good health insurance at the bank." I remember feeling really good. I was a banker's son that day. I don't think any kid in Iowa ought to worry about who their mother or father is to know they're going to get access to decent health care. And that's why this bill is so important today. And that's why Iowa ought to lead on this. We are better positioned than any other state in the union. The highest percentage of our population insured, 4th lowest costs in the country, 6th highest quality in the country. If we can't do this, no one can. So this is the first step in a process, and this bill is going to be worked through subcommittees and committees, and there's going to be changes made to this bill. And I don't know what all those changes will be, but we are not going to back away from the commitment when we finish this year to be able to say to Iowans, every kid has access to care.